be familiar with eczema in kids.
But it strikes adults too, and it can be very hard to treat. CBS 2's Dr. Max Gomez says researchers have found a new way to get rid of that stubborn eczema. Dr. Max?
That's right, Christine, Maurice. You know, even though many children eventually outgrow their eczema, plenty of adults have eczema. In fact, it's one of the most common reasons adults go to the dermatologist. Turns out there's more going on in eczema than meets the eye. It's bacteria, and there's a new treatment.
The back of my knees would kind of get irritated and itch a lot. So.
That's how Laurent Ben Simon's eczema first started at around age 15, and he's not alone. About 35 million Americans suffer from eczema.
Eczema is a chronic autoimmune condition. In kids, we usually see it on their face, and on their arms, and their elbows. Adults, when they grow into adulthood, tend to get eczema on their hands and feet, the most common.
While steroid creams often help control eczema, Laurent had a particularly resistant case, which happens quite often.
Itching, cracking, bleeding, and various symptoms kind of can be bad one day and can be okay another day.
That's what finally led Laurent to volunteer for a study that Dr. Gary Goldenberg was running. He cultured eczema patches from 60 patients and found
more than half of adults with hand eczema have Staph aureus on their skin. Now, this doesn't appear to be an infection. It seems to be a colonization, meaning that the staph is on their skin, but they're not actively infected necessarily.
Staph bacteria are everywhere, but for some reason they make themselves at home in the eczema, possibly adding inflammation that makes the skin problem hard to clear. Dr. Goldenberg found that when these patients used antibiotic ointment in addition to the usual steroid cream, their eczema cleared much more often.
It was only a few days and nights of treatment, and it worked, like just zapped it away. Pretty remarkable.
This is Laurent's eczema before treatment, and this is what it looks like today. Not completely gone, but much reduced and tolerable. Another concern is that staph bacteria are transmissible. The theory is that adults with staph on their hands could spread the germs to their children, making their eczema much tougher to treat. Antibiotic ointments have been shown to help clear resistant childhood eczema as well. Maurice?